Lots of news. I think the, to me, most exciting news related to my immediate updates from HHS. No matter what you think about their rights or wrongs, there's one big, really important update is that the HHS is now basically recommended to Medicaid to stop placing any amalgams for any reason, period. It's not a complete whole country ban on mercury fillings, but it's the first step into that direction. In fact, it's probably the only step that needs to be done because in reality, most of the dentists have stopped placing amalgams due to expected multiple class action against dental organizations and dentists. In Europe, that's already been going on for quite some time, and I think expectations are the same that basically, any major changes in the US happen through the legal system. So I pretty much assume that that's what's going to happen here. But in Medicaid population, this was the only routine location where and I don't know if I'm pronouncing the word correctly. I just realized it probably is amalgams rather than amalgams. I think amalgams is kind of just how I always said it, but it's wrong. So it's amalgams. And amalgams have about a 50% weight being actual mercury. I always give this funny joke that if you take one large amalgam out of someone's mouth, grind it to the pulp, put it in an IV, and then inject into the vein of an elephant, the elephant will die within 60 seconds. And so we've been putting these things into people's mouth for decades, and then voila, finally, at least one US government branch said enough is enough. There's a clear-cut harm that's been documented for many decades. Why are we still doing this? So it will be interesting to see what that will trigger. As I said, I'm predicting there will be class actions left and right. I will be joining one for sure because I was harmed by these feelings very badly as a young adult, and luckily I just found a way out of this mess. On the peak of this topic, I had 14 fillings. I'm probably going to make a separate video about this topic, so stay tuned for that. So I'm just going to stop with this news at that, but of course, you guys can ask me questions about it, so I'm happy to answer them. There is a website now, of course, government tries to do things quickly. So here is the official website on the government that sort of describes why should you be taking these fillings out of your mouth. Hold on, so let me get to the chat. Okay, there we go. So, and again, this is obviously a huge change, right? All prior administrations were basically saying, oh, these things are completely safe, do whatever you want. Now, finally, they're acknowledging the harm. So that's news number one. And, beyond that, I don't really have any COVID or any other infections updates. I don't think that crypto, as we discussed the last couple of weeks, have been in the news much. It appears that kind of this short-lived local Maryland minor explosion of the cases have subsided. So if it changes, I'll keep you guys posted. And my other quick update is I finally Janet already put a Medicine for All People podcast into the podcast, but I finally put this on YouTube. So if anybody wants to see it on YouTube, here's the link. Just a reminder, this is with Dr. Geeta Clark. Geeta, what's her full name? I keep forgetting. And Geeta Maker Clark. And this is about her new book, Medicine for All People, which I highly recommend everybody to buy. We're going to do a little bit of a practice today from her book. Well, it won't be from her book, it'll be my practice, but I'm putting it in the context of one of the chapters of her book. And that's it. So, okay, so let's do questions in whatever order they're coming. Linda is asking, please explain the importance of biologic dentist, importance for removing amalgam. So really good point. Thank you. Thank you for pointing that out. So people who are young and very healthy and don't have money, I think removing one amalgam at a time slowly may make some sense. The problem is when you're drilling these fillings, they are the vapor gets exposed at the very high level. So basically, if there are no special precautions, if you're drilling them out, often in the past, dentists were saying don't do that because the harm of removing them will be higher than leaving them inside. It's true in a way. If you're drilling with a regular drill and you're not taking precautions, and I will talk about this in a second, the exposure during taking them out will be massive. And so it's highly discouraged for people to do that, especially if they have any mercury related issue. And there are about maybe 200 to 300 diseases that mercury from silver fillings can cause, roughly in that magnitude. Pretty much all chronic neurologic conditions, most of metabolic disorders, most of autoimmune conditions, all of them can have mercury as a key driver or as a cause, or at least a contributor. So don't do that in that sense, because you potentially, if you already have one of those conditions, you may actually make it a lot worse. So what is biologic dentistry is basically making precautions that when you're taking care of the silver fillings out, you have a way of preventing the exposure of the patient to the vapor, to the drill. When you're drilling, there's a vapor that's coming off the surface. Plus, by the way, little pieces also can end up inside the mouth and get absorbed gradually into the blood. So that's also an exposure source. There are two types of safe biologic removals. One is kind of rarely practiced, where the drill occurs under the water. So basically, a drill goes through the layer of water and they're drilling under the water. There are very few people who've done this. One of my favorite local dentists who passed away some years ago, Dr. Singer, was doing that, but I'm not aware who else is doing this particular style here. That's considered the best because there's really minimal to none vaporizing, but it's very technically difficult. Most of the biologic dentists use this method of suctioning, high pressure vacuum suction that removes all the vapor out. There are certifications. I think there are two different types of biologic dentistry certifications. So if you're going to shop for someone, please make sure that they're within that network. It's pretty straightforward. You can easily identify that. And if anybody's interested, we can discuss which particular dentist I refer patients to if they need to have the amalgams removed. Good question. All right. Any other question? We still have at least a couple of minutes. Okay, so Cecily's asking me personal question, but it's a great question to put in the chat. So let me put that in chat for everyone if this was her question. So, well, I'm not hearing of anybody getting boosters. Nobody should be getting any boosters right now, senior or not. It makes zero sense because the current boosters don't cover current strains, so it's completely irrelevant. Now, if you never had a booster, of course, you may consider getting it. But if you had a booster back in the fall of last year, there's no point in getting it. You know my opinion. I highly discourage people from getting 2 shots a year. It makes no clinical sense of any kind. Why FDA recommends it? My sense is very simple. If they recommend taking it twice a year, maybe people will take it once a year. If you recommend taking it once a year, people will start taking every other year. I think this is more related with just human nature rather than any logic of any kind. I'm just gonna leave it at that. Okay, Salome, let's unmute you and go ahead and ask your question.
Thank you. I know you have talked about peptides before, but for
Okay,
some reason I have been hearing about peptides
great.
and
Yeah.
the federal government. What's it all about?
Yeah. So great. I'm so happy you mentioned because I was going to talk about this and then I forgot, of course.
Okay.
So the point with peptides today, again, I think mercury issue was yesterday. Today, there's an announcement that FDA is going to allow compounding pharmacies officially produce peptides and that they're not going to be, you know, prosecuted by any government agency. So they're basically allowing, without actual FDA approval, to have compounding pharmacies to make the substances. Before I actually go into more on this, so peptides are typically naturally occurring small molecules. They're in our blood, or they're either directly in our blood the way they are sold, or they are in some kind of modified form. And the peptides, everybody know peptide. Here's a quiz. Who can quickly put in a chat what are the peptides are now used pretty much in like half of them? Well, not half, I don't know. Probably 20 to 30% of Americans already using peptides. You all know. No, no, of course. Yeah, GLP-1, of course. So Ozempic and such, they are peptides. And they are naturally occurring peptides with some modification depending on sort of how you look at what do you call natural bioidentical versus non-bioidentical. I'm going to lay those things to rest. It doesn't really matter for this conversation. Um, and so the particularly peptides that been discussed in this new FDA approval, or rather lack of not allowing, there's no actual formal approval for any specific condition because there's no data. There's BPC 157, which is used heavily for gut health, for tissue repair, etc. There's actually several clinical trials underway. There's a clinical trial for Crohn's disease using BPC 157 orally. It'd be very interesting to see what happens. There's a list of them. My opinion on peptides is very guarded. I have seen lots of patients taking them. I have seen very little of any substantial clear benefit. I have seen some patients swear by them, so I will say that, particularly BPC 157 probably would be the one I would say I have seen more positive results where I didn't think it was purely a placebo or just some kind of a, malrepresentation of particular effect. So I do think that the peptides will have a lot of pearls down the road. What really is difficult to figure out today is what those pearls truly be. I am frustrated by lack of attempt at researching them because one of the huge benefits of peptides potentially down the road is that this substance is indeed biologically more or less similar to lots of our own things, right? So the GLP-1 is a great example. Once they realized it's working, you see what happened, right? So there's this mass explosion of utilization. Peptides should not have a crazy cost. The fact that some of the pharma is gouging right now and selling them for hundreds and hundreds of dollars a month, that's a period. I think it'll kind of level itself off and eventually they'll get cheaper. We're probably going to see the same thing with the rest of them. Peptides, including BPC 157, are quite expensive right now. So if you are to buy it on free market for, especially for injections, you'll be spending many, many hundreds of dollars a month. The oral forms, there are some sublingual liposomal forms that will be a little bit cheaper, probably closer to 200 range, or maybe even 150 a month if you use lower doses. Again, would be there a particular indication? I'm basically flat going to say no, and there are instances where I try them. And I'm going to leave it at that because I don't want to give you a sense that those instances are well evidenced. Basically, sometimes I would try peptides where everything else fails and we're struggling to move with the process forward. That's when I sometimes apply them. That's a great question, though. Thanks. All right. All right. Salome, is that helpful? Or did I miss something? Okay, hopefully I covered that. All right, let's take 2 more minutes before we head it over to David. Maybe one more last question. And if there is no questions, then we can move to David. Okay. Well, David, thanks so much for being here. Lovely to have you. Maybe introduce yourself real quick. Also, whatever you want to say to folks beyond what we already said, and begin.
Sure, sure. Well, thank you, Misha, for inviting me. I am Dr. David Fakunle II. I am assistant professor of public and allied health at Morgan State University in the School of Community Health and Policy, also associate faculty in mental health at the Johns Hopkins Bloomberg School of Public Health. I think what brings me here is the space that I occupy in public health, which is at the intersection of arts, culture, and health. So before I got my PhD from Johns Hopkins, I had a PhD in Black storytelling, being able to learn from some of the preeminent griots in the United States at the time. And my life has been surrounded by creativity from the beginning. And for the longest time, I thought it was just the circumstances of my life. Uh, at this point, I realized how consequential being around creativity, arts, and culture have been to not only who I am as a person, but how I show up as a public health professional. And it's really to create opportunities and moments for people to be reminded that creativity is an essential element to health and well-being. One of the important things to know is that you don't have to be good at the creative expression. You just have to do it, be around it, experience it. You will have some benefit. And typically, those benefits start with how we feel. And I think part of my work is also to just encourage people to see the value and the validity of their own stories and living experiences. So, coming up as a drug epidemiologist. It was all about the statistics. It was all about the numerical figures. And those numerical figures, to the best of my knowledge and experience, do not capture context. But what does capture context quite perfectly are stories. And so the sharing of narratives, the reflection on narratives, and certainly the learning from narratives offers context, it offers living experience, and the practice in and of itself can be beneficial to one's health and well-being. And so I'm going to give you an example right now. I thought I was going to do slides. I'm not doing slides. We just going to tell stories. So I want you all to come with me on a journey. We're going to go to a forest, and every day there would be an elder woman who would walk through this forest. In the forest, she would take in the sights, the sounds, the smell, the touch, even the taste of the forest. And she did this every single day like clockwork. It didn't matter whether it was rain, sleet, snow, hurricane, tornado, mudslide, you name it, nothing would stop her from having those moments in the forest. Because for her, that was where she was one with herself, and that was where she was one with the divine. So it was her ritual, it was her sanctuary. On this particular pilgrimage, the elder woman came across a stone. And I'm sure you can imagine that as an elder woman, she's seen a lot of stones. She's seen the bright ones, the dull ones. She's seen the round ones, the not so round ones, the jagged ones, the smooth ones. Any stone that you could conceivably imagine, this elder woman has seen it in some form or fashion. And so when she came across this stone on this particular day, she knew there was something special, something precious about it. So what did the elder woman do with that precious stone? Well, she picked it up, she put it in her pouch, and she continued to walk through the forest. As she was continuing on her pilgrimage, she saw a figure in the distance. And as she continued to walk closer and closer to that figure, it started to take the form and shape of a young man. And as she continued to get closer and closer to this young man, she could see with her own eyes that this young man had been dealing with some challenges, some troubles, some struggle. She could see hunger written on his face. She could see thirst written on his face. She could see tiredness and exhaustion and pain written on his face. She could tell with her own eyes that whatever life was dealing this young man, he was seemingly coming up on the losing side at every single moment. The young man finally got within an arm's reach of the elder woman, and he dropped to his knees and begged her. He asked, "Ma'am, do you have anything that I can eat? Do you have anything that I can drink? Do you have a place where I can lay my head just for an hour? Do you have anything that can tend to my wounds, my cuts? Ma'am, can you help me, please?" It was clear that this young man was at his most desperate for any type of assistance he could get in this moment. But then his eyes saw that precious stone. And when his eyes locked onto that precious stone, he was no longer thinking about his hunger. He was no longer thinking about his thirst. He was no longer thinking about his tiredness. He was no longer thinking about his exhaustion. He was no longer thinking about his pain, because the only thing that occupied his mind in that moment was that stone. So, seemingly mid sentence, he stopped and he asked a new question. He said, "Ma'am, may I have that stone in your pouch?" With no hesitation, seemingly no thought, and with no words expressed, The elder woman went into her pouch. She took out that stone. She put it in the young man's hands and she walked away. And so the elder woman is continuing her journey through the forest, and the young man is standing smack dab where he met that elder woman, looking at that stone in his hands. And he hasn't taken his eyes off of it for a second because now the thoughts that are running through his head are that he'll never be tired again. He'll always have a place to lay his head. He'll never be thirsty again. He'll always have something to drink. He'll never be hungry again. I'll always have something to eat. Anything that he ever dreamed of, wished for, imagined, prayed for, the answer was in his hands, and it was that stone. But after a while, that young man actually lifted his head up and took his eyes off of that stone. And when he did, he was reminded that he was in the forest. It was not just what he saw, it was what he heard, it was what he felt, it was what he smelled. And when he looked around, he was even able to find something to start to quench his hunger. After a while, that young man turned around in the direction of the elder woman who was still walking, and he started running to catch up with her as quickly as he could. And eventually, he was able to catch up with that elder woman and stop her for a moment. And when he did, this is what the young man said to that elder woman: "Ma'am, take this stone back. I don't want it anymore. What I do want is whatever it is inside of you that allowed you to give me this stone so freely." My question to you all, and please feel free to respond however you see fit. If you want to say it out loud, if you want to put it in the chat, I will ask you, what was inside of that elder woman that allowed her to give that young man the precious stone so freely? What comes to mind for you? What quality? What characteristic? What virtue? What was it? I see compassion. I see love for humanity and empathy. Thank you for sharing. Anyone else? What resonated? What showed up in the elder woman's actions that were easy or clear to see for you? Anyone else? Heart of abundance, generosity of spirit, love and compassion. Thank you all for sharing. Living in the present moment. Absolutely. Absolutely. And so this is a folk tale that I have told, I'm pretty sure I'm creeping up on at least 1,000 plus times, if I'm still maybe in the high hundreds. It's a signature story for me because it not only captures the essence of what I do and what I look to present to the world, but it's always a good opportunity to see how we're thinking and how we're feeling uh, when we think of acts of generosity, acts of kindness. We take the action, but we're able to synthesize what it manifests, these qualities that were mentioned in the chat. So I'll say them again. What the elder woman did was an act of compassion. It was an act of love for humanity and empathy. It was an act of abundance, recognizing that she had what she needed. It was an act of generosity of spirit. It was an act of love and compassion. And it was an act of living in the present moment, right? Um, and an act of capability, right? Absolutely. There has never been a time for which I've asked those questions after telling that story that I've gotten any responses different than what was put in the chat. And I have told this story in many different spaces. As they may put it, from the outhouse to the penthouse, I've told this story. From people who have all the letters behind their name to people who have no letters behind their name, to people who have several zeros in their bank account, to people who have only zero in their bank account. And despite all of that, we come up with the same answers, the same synthesis for a story like this as to what was inside that elder woman. And it goes right to the moral of the story. The moral of the story is that the precious stone was not the physical thing, it was the action that that elder woman expressed, and it was the spirit in which she did it. So those qualities that you all mentioned are the precious stones. And like the elder woman did with the physical stone in the story, but also representing who she was as a person, we're supposed to give that freely. Give it freely to the world. And the part that's not necessarily in the story, but certainly reflected in my personal story, is that the world will give you so much back and then some. That is the reason that I'm speaking with you all today. Sure, I do have some letters behind my name, so I'm not going to be a hypocrite. But what has allowed me to navigate spaces, I think, with a confidence and a certainty, is knowing that when I get to tell a story, it is not only creating a moment of uh, knowledge and understanding, but most importantly, connection. And that connection goes beyond race, it goes beyond ethnicity, it goes beyond language, it goes beyond wealth, it goes beyond education. It truly boils down to the core determinants of our humanity. One way that I've tried to make sense of that is what I call the existential determinants of health. And it is a play off of social determinants of health, but also a recognition that for the public health field to move past just the labels that define us, we actually have to look at the definitions. And so when I think about what defines me or how I'm labeled in terms of race, I am Black. I am of the African diaspora. The question that I would ask you is, what does it mean to be Black? What does it mean to be of the African diaspora? And there's no label for which we shouldn't be asking those questions. What does it actually mean? And that is reflective of the cultural determinants of health, right? What makes us who we are and how we navigate the world. And along with the recognition of those nuances, those contexts which make up everything in public health, there was also the acknowledgement that fundamentally we all want the same thing. And I have yet to find any practice that makes that clearer more than storytelling. And that is why it is the foundation of everything that I do in public health. And I will tell you what we all want. And I do this too as an activity. Tell me if I'm wrong. In full openness, full transparency, full vulnerability. Tell me if I'm wrong. Here we go. I now want you to picture the last moments of your life. And I'm going to create a scenario in which you have the opportunity to reflect before you transition. You are of sound mind, you know that the time is near, and you are in that period of going over the story of your life from as far back as you can remember to this current moment that will soon be the end of your story, certainly in this realm. During those moments of reflection on the life that you have lived, do you want to know whether you were acknowledged? Truly acknowledged? Do you want to know if you were truly appreciated? Do you want to know and feel that you were truly respected? Do you want to know and feel that you were truly understood? And do you want to know and feel that you were truly loved? So, as you imagine that moment of your last moments, are those the things that you want to transition with full certainty and understanding of? That you were acknowledged, appreciated, respected, understood, and loved. And there can be variations of that. I completely understand, but this exercise is about boiling it down to brass tacks, as they say, the simplest of the simple: acknowledgement, appreciation, respect, understanding, and love. To me, those are the existential determinants of health. Everything that we look to achieve, experience in this life boils down to some manifestation of those core virtues, those core experiences. And so with storytelling, it creates opportunities to be reminded of that fundamental truth. And what has been a great uh, health practice, but also health promotion, is that if we can start with that fundamental understanding in any room, whether we're talking policy, whether we're talking practice, whether we're talking research, anything, if we can start with that core understanding, then we can have the difficult conversations and we can do the difficult work because it gets no simpler than that. That's what we want. And so I represent a field that recognizes that truth and aims to give it to the world through our precious stones. And those precious stones are arts and culture. So my particular creative energies are storytelling, grounded in the Black oral tradition, as well as African drumming. I'm not going to do the drumming for you today because honestly, it doesn't come over well in Zoom. But drumming is also an opportunity to be centered in what matters. And along with those existential determinants, we are bound by rhythm. uh, Misha knows this better than anyone, right? If the rhythm of our bodies aren't moving as they should, our bodies don't operate the way they should. And that certainly has translated to our expressions of rhythm outside of our bodies, right? I'm sure everyone at some point has played some type of rhythm on their physical body, right? And some of us, if we really want to get to it, translate that to various instruments like djembes. It never ceases to amaze me that even if a person has never experienced a djembe in their life, they cannot help but to get into it. They cannot help but to move some part of their body because, as many people have conveyed, it's the vibrations, right, that a djembe gives off that just seems to resonate, literally and figuratively, so well with the rhythm of our bodies and the rhythm of our movement. So even if you think you can't dance, you'll dance to a drum, you'll dance to a djembe because again, it calls you to move. That is the purpose of a djembe, is to catalyze movement, to catalyze communication, but to catalyze moments of connection. And that can be through singing, through dancing, through cultural traditions, through rituals, through any form of imagination that we bring to life. That is arts and culture manifest. And there continues to be a growing body of evidence of embrace, acceptance that it is a necessary element to health and well-being. And quite frankly, it has been missing from the public health field for a very, very long time and can be a methodology by which certain gaps and certain, I would say, chasms within the field of how we truly promote well-being, not just the absence of disease, but the best of our lives. Arts and culture has always done that. And now there is I think, a greater integration, I think a greater reimagination that's happening in the field with arts and culture being considered one of those core pillars. And for my money, I would say that even if you don't necessarily want to subscribe to arts and culture per se, as long as you have storytelling, you're good. That is absolutely a missing pillar of public health and healthcare overall, because for all of us, and none of us are immune to this, the best way that we can convey this thing called life is through our stories. And so when we have the opportunities to share how we feel physically, emotionally, mentally, psychologically, spiritually, financially, economically, the list goes on and on and on. Those stories are valid data. Those stories are valid evidence as to how you, the individual, we, the collective, are navigating this thing called life and how it is connected directly and indirectly to our sense of well being. And so that's what my life's work is about. I'm grateful to do it with a smile on my face more times than not, because along with encouraging people to embrace their stories has helped me to embrace mine. So I am very adamant that my work is also my therapy. It's my healing. I am sharing things that are happening in my life at times with the audiences with whom I get to speak, even if I never see them again, because it is a moment for you all to know not just Dr. Fakunle, but David. And they are one and the same. And at the same time, there's the compartmentalizing that we all have to do in our lives. But the more that we can integrate our true selves in all the spaces that we occupy, I truly believe that makes us healthier overall. And so I'm happy to take any questions, explain anything that I just talked about. But I hope that in that moment where I shared that story and made space for you all to reflect on it, you saw yourself in the story, whether you were the elder woman or whether you were the young man. Please know that who you are is exactly what the world needs, and exactly what you need as well.
David, let me put you on the spot. I
Go
think it's
for
a
it.
question that I always had in my mind. What do you think would it take for the healthcare system to make this universally accepted tool? Meaning, we talk about physical therapy, we
Hmm.
talk about psychotherapy being covered, we talk about screenings and all that. And you
Hmm.
think about this in global and like, well, this is just as important as everything else I just mentioned, right? So why no one ever discusses this being part of a standard coverage by
Hmm.
time, and I been debating this in my head forever. Like, how do you cost cover pieces like this? Have you ever thought of anything like you ever came across any models that would actually be implementable?
Oh, that's a good question, Misha. I would say, can it happen? Yes. As with many things, when it comes to shifting, entire fields, right? It takes time.
Of course.
But I come to you all today as a living testimony to things happening that have been beyond my imagination. My foray into the intersection of storytelling, particularly and public health, started as a class project. My first year as a doctoral student,
Hmm.
and it was the thoughtfulness of my instructor. I think my office mate dropping the hint that I was a storyteller that created this path that has allowed me to show up in this world as authentically as I could have ever imagined. And that includes being in spaces of public health and healthcare, where certainly, if I think of the time then to now, there is more of a receptiveness to this idea of creativity being part of the treatment plan, right? From the healthcare side, but also creativity being part of the prevention plan on the public health side. And both things can happen at the same time and should happen at the same time. But if I were to think of it simply and certainly reflect on what has helped me a lot in my career, it's creating a moment of reminding people,
Hmm.
right? So and I take great pride in doing it, particularly in the spaces that are so not ready for it, right? The professional
Hmm.
conferences, right? The
Right, right.
meetings with the leaders of this and that. I enjoy stripping away the labels,
Hmm.
especially the labels of power, right? And reminding them that there is an ultimate power, and that is the power of humanity, right? We're all bound by that power, and storytelling captures that power to me more efficiently and effectively than anything.
Hmm.
And I don't want people to just think about storytelling as the oral transmission of narrative. That's certainly what I do and how I do it. But any expression of a narrative of a story is by its very nature storytelling. And so once I introduce people to that, they can't unsee it. I guess I equate it to eating the forbidden fruit in the Bible, right? Your eyes are open, you can't close them again, because you will see storytelling everywhere, and you'll be able to uh, think more critically about the narrative that is being conveyed, right? And thinking about the audiences to which that narrative is being conveyed and for what reason.
Hmm.
Um, it's happening all the time, and most of the people that I meet are story. Well, everybody's a storyteller, right? Every single
Hmm.
person is a storyteller. Point blank. Period. If you are a human being and you communicate with other human beings, you're a storyteller. What separates me from a lot of people is intentional storytelling. So understanding the nuances that go into the crafting of a narrative and also the thoughtfulness of conveying that narrative so that your audience receives it. And that's why the creativity is so necessary. Not
Hmm.
everybody is going to receive the message through oral expression, but dance, prime example, rest is conveying a story. And growing up with African dancers, I can tell you their movements are telling a story. Um, it's endless the possibilities of how a narrative can be expressed, and yet there's certainly something about listening to someone's voice. I think creating an environment of what I call mutual vulnerability, where it doesn't take very long, again, for that stripping of labels and power to happen, even with people who are so prepared to stay in, I think, in those spaces. Uh, and that gives me the moment to say, this is what it's all about. I don't care how powerful you are. You're mortal just like I am, and you're thinking about the same questions of life as we all do. So it's my nice way of saying, why are we BSing each other, right? Why are we creating so much headache for each other when we all want the same thing? Easier to catch flies with honey than vinegar, right? And the many idioms and proverbs that speak to that premise. And certainly I'm grateful that I've been able to operationalize that by just telling people it's okay. Yes, this life thing is weird, right? All the money in the world, all the power in the world does not exclude you from the weirdness that is life.
Mhm.
Let's be able to honor that. Let's be able to speak to it. And let's also see the connections across all of our living experiences. And it becomes like a light bulb for people, right? And I don't take that for granted either. It seems so simple because it is, and yet life is complicated too. So being the person creating the moment to say, yeah, keep it sweet and simple. This is what the whole point is. I think creates enough of an opportunity to say, all right, and here's how we can operationalize that within the context of this field, in this
The
work.
biggest way I have a vision of this, and actually it highlights what Jennifer just put in the chat. I think the only way to operationalize this is to create a Cleveland Clinic-like model.
Hmm.
And I'm not talking about for evaluation exclusively. I'm talking for the entire care.
Hmm.
Basically, you come to your doctor or team, you have an evaluation of some sort, and there's a 6 or 12 months package that's created. And part of that, you simply say, yeah, and this patient should benefit from storytelling. And yes, they should benefit from some structured movement prescription.
Hmm.
And then insurance, instead of saying, okay, well, fee for service for engaging with a coach who can teach you how to tell your story for healing, instead of like fee for service there, you simply have some model where there's an estimate of cost of
Hmm.
care for the particular enterprise that's going to manage you per period of time. What we sometimes call packaged care or packages or capped. There's all kinds of terms for this. And
Hmm.
interestingly, the model is already getting kind of towards that way because the fee for service model is so rotten and
Hmm.
basically so abused that there's just really clearly no way out of it. Like there has to be shut down in many ways. I mean, sure, certain things will stay fee for service. I can't imagine fee for service going away completely, but I can imagine that for chronic illnesses or chronic care management, you need to have you just pay to a particular facility a set fee and then let the facility figure out how are they going to incorporate this, and they're probably going to be champions. There are going to be some places where they will hire you to facilitate it, or they will come up with some system of coaching where every coach has been trained in this.
Hmm.
And in my mind, it's actually very realistic and very close to happening right away. I mean, we discussed, at least in this meeting and in some of our podcasts, this upcoming, like University of Vermont has a structured program to do this, for example,
Hmm.
to do a chronic pain management where they include all kinds of stuff. So I think it's going to happen. I hope that as some of the structures begin to open up for alternative ways of reimbursement, that we're
Hmm.
going to see the storytelling getting into these models, just like exercise prescription. Or we
Hmm.
a couple of weeks ago we had someone who would do a basically a nature prescription, right?
Hmm.
So
Hmm.
anyway, thank
Yeah,
you.
no, well,
Yeah,
social prescribing is the next wave of elevating the arts, culture, and health field. And so
absolutely.
states have already implemented it where, yes, insurers will reimburse you to engage in creative expressions if it's prescribed by your provider. And so that's great and has opened up a lot of doors for artists and creatives who were already doing the work, but to now kind of have this pipeline for some economic sustainability.
Mhm.
Uh, to some of the questions, and I'll try to incorporate some of the questions in the chat in my response. Uh, it can I think there's so many ways by which you can get a health benefit from arts and culture. Certainly, just having the experience of being around it has its own set of benefits, and I will say that a lot of it does show up in terms of mental and social emotional health. I think that's one of the easiest ways to ask a person about the benefits of arts and culture. I'll do it right now. Do you all feel a little bit better after hearing that story? Yeah, there you go. So, so for me, I don't deny the stories as valid evidence. But certainly as a public health researcher, I'm also interested in the other ways that we can build the evidence base. So thinking about dance, for example. So yes, the physical activity related to dance, whether you're just doing a two-step or you're doing full-fledged African dancing, your body will benefit from just the movement that comes with dance. There was a question about the cultural context to the dance. Well, you could have no direct contact. I'll use African dancing because that's just again where how I grew up. There were plenty of people who were outside of the African diaspora directly who engaged in African dancing. They certainly were going to get a health benefit simply from the physical activity alone. For those within the African diaspora, there are certainly cultural health benefits that can be added on top of the physical health benefits because, yes, having understanding of yourself, we can call that self-esteem, right? We can call that self-efficacy. Not only has this kind of baseline human framework, but also a cultural framework that goes on top of it. So when you think about the systems of oppression that do exist, like racism, like sexism, on and on and on and on, if you are able to be your true self within those various dynamics of humanity, you're going to be even healthier on top of whatever uh, physical activity you may be doing. But nevertheless, the engagement with the creative expression, the receipt of the creative expression, the creation of the creative expression, no matter how you show up in the space, there will be a benefit to you. So thinking about how storytelling could help with physical health, if someone were attuned to improving physical outcomes or encouraging more movement, you can absolutely create a story that involves body movement. Even if we go back to the story that I told, the precious stone, we can act out that story, right? Everyone, wherever they are, can do the motion of walking through the forest, right? Even in your chair, right? Just moving your legs up and down, right? Arm side to side, right? Like the elder woman. You can do it slow, like the elder woman was doing, right? We can pantomime the reaching down to get the stone, right? We can pantomime the movements of our head and our neck to look at all the things in the forest. So, artists and creatives are particularly good at flexibility. And certainly when they are in a space where they have to incorporate a health context, I trust their creativity to know how to do that in a way that's still authentic to the creativity, but also speaks to the particular health dynamic that needs to be addressed within the creative expression.
Great. Well, thank you, David, so, so much. I'm sure we'll ask you to come back in no
Happy to
due
do so.
time. I have a strong feeling people love this, and I think this is a topic that never ends and needs to get recurrent. It's really interesting, though. This wasn't planned. I didn't, well, I mean, I knew what you're roughly going to talk about, but I didn't specifically organize anything. But when I was trying to figure out what kind of breathing practice or meditation we're going to do in the last couple of minutes, I'm still fascinated by Geeta's book, Medicine for All People. And, there's a whole chapter here on trust, how basically in the last century, or maybe more like last 60 years, the trust in the healthcare system has been completely eroded. And, they're basically a very large proportion of population that doesn't necessarily fully engage in a standard of care for the reason exactly that basically the trust was eroded to the point where patient wouldn't go to the doctor even until there's some really true bed emergency. And believe it or not, this is topic that really is not discussed enough. And yet this lack of trust is a massive problem. I mean, somewhere of about 30% of entire population mistrusts the healthcare system. If you think about that, what that implies, it's 100 million people in US alone, roughly. So yeah. Um, so Gita has a whole chapter. I'm going to read you a little piece here. That kind of speaks more towards, we can't fix the underlying problems, right? I mean, we can't fix certain things, but we can start creating or basically trying to enhance our own sense of trusting, at the very minimum, trusting certain providers, even if we as individuals decide that we're not going to trust the entire healthcare system. And by the way, I'm including myself into this. I'm as an insider in a healthcare system, will never trust certain parts of healthcare system to treat me right, And so, while I'm maybe speaking from certain point of privilege, the way was growing up and I am now, I still acknowledge that this touches almost everybody, and it touches some people a lot more than others. So, rebuilding interpersonal trust, meanwhile, is being nurtured in spaces like the mutual aid network. So, she describes this community building efforts build trust. Hyperlocal, volunteer-driven systems of care, from grocery deliveries to rent assistance, demonstrate that when institutions fail, communities can and do show up for each other. I think this fits with what David does really, really well. Uh, those meal trains, GoFundMe, donations, check-ins, and other acts of charity build trust between people. Their continued presence challenges to rethink what governments could look like if we to build on relationship rather than bureaucracy. Restoring trust is not a passive return to the status quo. It's a radical and necessary reimagining of how we live and lead together. It demands we honor lived experiences, share power, and build systems that reflect the interconnectedness of our futures. With trust, democracy and healthcare becomes participatory on the most personal level. Without it, even the most well-designed policies will always fail short. So the way I let my own system to help with the positivity in cases like this is breathing. And so what I offer you in the last couple of minutes that for us to do is to close our eyes. Make sure if you're sitting, try to sit with your back straight, although if not, that's fine. If you're laying down, just that's okay. So whatever the position is, just make sure you're comfortable. Find your breath. And the next thing is put your awareness into the heart. Imagine that you're breathing in and out of the heart. So you're inhaling, imagining air coming into the heart, and then when you exhale, it radiates back. Obviously, this is imaginary practice. You can put your hand over the heart if you prefer. Sometimes it helps to feel the pulse, to feel the actual heart beating. Or you can simply imagine it being there. After a couple of breaths, when you're comfortable with this awareness, on each inhale, bring a positive state of awareness. Basically, you can invoke sense of love. Maybe you can think of someone who's near and dear to your heart. Could be a human, an animal, a place, your favorite object. So just take a couple of breaths, breathing in compassion, beauty, love, and then exhale back into the world. So this is a practice called quick coherence. We've done it many times on this channel before, probably has many other names. So now that you're comfortable with this state of positivity on each breath in, we're simply going to put our own sense of trust into each other, into the health system, into this space. We're not going to put any attachments to it. We're not going to put negative or positive emotions. We're simply going to place in this vulnerable place of our hearts a system that's inefficient and ineffective. And just keep it there. Just keep breathing in and out of the heart. Inhale, positive emotion. Exhale, radiate it back into the space around you. What this practice in essence does is acknowledging a problem, but yet while we keeping attunement of our system at the balanced state. At the very minimum, it will allow us to move forward with our own grievances, with our own distrust, with our own emotional disturbances, making them more neutral, making them easier to live with. Let's just take 2 more breaths here. Well, thank you all for coming. It's wonderful to have everybody. We hope that you have a great weekend. It's going to be gorgeous here in DC area. Temperature is finally manageable. You know the drill. If you're my patient, you need to discuss anything with me, medical preferably, although I'm willing to stay even for non-medical stuff. Please stay here. Otherwise, I will not be with you next week. We will have Essie, I believe. And I don't know if I'm going to try to see if Ashley or Deidre or somebody else will come in case there are medical questions. But I'll see you the week after. I'm just kayaking, our usual week off. So I'll be thinking of all of you being on a beautiful river, paddling, catching some fish, maybe.